RITM. Do we have na Director Carlos?
Morning po.
Hi, Director.
Morning po.
Morning.
Magandang
Morning,
umaga
Miss
po.
Dec.
Morning, Madam Chair.
Okay, good morning again. Can we start na, Sir Erwin? Comsec?
Ma'am, this is Dayan. We can start now.
Okay, thank you. This meeting is now called to order. May we hear a motion?
Madam Chair,
Yes, Kong Jun.
I move to defer the calling of the roll.
Second, Madam
Second
Chair.
the motion, Mr. Chair.
There's a
Madam Chair.
motion. There's a motion to defer the calling of the roll. Duly seconded. Is there any objection? Hearing none, the motion is approved. May I call on Ma'am Sylvia to lead us on prayer?
Ma'am, this is Dayan. Ma'am, I will lead.
Can you lead the prayer, please?
Yes, ma'am. Let us put ourselves in the presence of the Lord. Father in heaven, we commit this meeting to you. Come and reveal your will in every aspect of our lives and work. And as we discuss the affairs of this country, we ask for your will to be done. Show us your purposes. Enlighten us that we may know how and what you want us to accomplish in our task. We desire your glory and blessing in all we do. Direct our thoughts, words, decisions, and actions toward the right path and help us stay on track. Let your will be done as we plan and make decisions. Amen.
Amen. We'll now proceed to the approval of minutes of previous meeting. Can we hear a motion?
Madam Chair, I move that we approve the minutes of the previous meeting.
There's a motion to approve the minutes of previous meeting. Can we hear a second?
Second,
Duly seconded. Is there any objection? Hearing none, the motion is approved. I'd like to recognize first the presence of the following members. We have Deputy Speaker Rufus Rodriguez. We have Representative Adriano Epcas. We have Representative June Gato. We have Vice Chair Joet Garcia. We also have Representative Ging Suansing. We have our Vice Chair Marilu Arroyo. We have Representative Hector Sanchez. We have Representative Joy Tambunting. We have Representative Dalia Loyola. We have Representative Cheryl Deloso-Montalla. We have Vice Chair Ruth Mariano Hernandez. We have Representative, our Vice Chair Maricel Naganio. We have our Vice Chair Representative Sean Acop. We have our Vice Chair Joet Garcia, Representative Alberto Babi Pacquiao. We have Representative Rodolfo Ordanes. Who else? We have Representative Irene Saulog. That's all for now. Comsec, can you recognize the resource persons present on today's meeting?
All right, ma'am. For our resource persons, may we recognize from the Department of Health, Undersecretary Rosario Vergere, Dr. Arnel Rivera. From the DOH Disease Prevention and Control Bureau, we have Director Beverly Ho and Director Nika Howe. From the RITM, we have Director Celia Carlos. From the Epidemiology Bureau, we have with us Director Alethea de Guzman. From the Health Emergency Management Bureau, we have Director Gloria Balboa. Next, from the Department of Budget and Management, we welcome Ms. Jane Abelia and Ms. Maris Zalun. Also, Ms. Grace Darunday, Ms. Lyra Vitrudes, Ms. Charmaine Velasco, and Mr. Jason Wayan. From the Department of Finance, we have Mr. Joe Besmonte. Next, from the Civil Service Commission, we also have Ms. Sheila Acuña. That's all for now, ma'am.
Thank you. Good morning again, distinguished colleagues and to our resource persons. Today, the committee shall devote its time in the deliberation of the substitute bill, establishing a Center for Disease Prevention and Control, which aims to modernize the Philippine health system and ensure that the Philippines is well prepared to forecast, prevent, monitor, and control diseases, injuries, and disabilities of both national and international concern. It would be recalled that the last meeting of the Committee on Health on CDC bills was on August 24, 2020. Upon the request, however, of the DOH, the committee gave way to the internal and external consultations that the agency had to undertake with various stakeholders, including experts on the field like World Health Organization. This with the end in view that the DOH would be able to study further the proposed legislations and come up with the more sound policy recommendations. The committee also conducted two TWG meetings. The last one was February 22, which was facilitated by this representation with the help of our Vice Chair, Joet Garcia, and Representative Cheryl Deloso-Montalla. A, tot- a total of 13 House bills establishing the CDC were referred to the Committee on Health. These are House Bills number 6096 by Representative Chair Salceda, House Bill 6383 by Representative Haresco, House Bill 6633 by yours truly, House Bill 6651 by Representative Vice Chair Garcia, House Bill 6655 by Representative Montalla, House Bill 6711 by Representative Chipeco, House Bill 6718 by Representative Hernandez, House Bill 7013 by Representative Vargas, House Bill 7243 by Representative Espino, House Bill 7283 by Representative Villafuerte, House Bill 7366 by Representatives Ging Suansing and Toto Suansing, House Bill 7290 by Representative Tambunting, and House Bill 7314 by Representative Rodriguez. The substitute bill before us now takes into consideration the recommendations of the Department of Health, being the primary national agency that will be primarily affected with the establishment of CDC. As proposed, the CDC shall initially prioritize disease surveillance and prevention and control of infectious diseases. It shall then include non-communicable diseases upon positive recommendation by an independent study or body commissioned by the DOH at least 5 years after the creation of the CDC. The committee deems it very urgent to legislate the establishment of CDC in light of our experience with the COVID-19 pandemic, which has claimed the lives of millions of people of the world over, coupled with severe economic woes that besets the Filipino people brought about by the dreaded disease. However, the committee is cognizant also of the intricacies or complexities of restructuring, if not substantially reorganizing the DOH with the proposed establishment of the CDC. In doing so, the committee is likewise cognizant that it will have strategic ramifications to the delivery of health services by the Department of Health. As such, a viable transition process is imperative for the eventual transformation of our healthcare system to one that is more responsive to public health emergencies. In transition, the CDC shall be administratively under the Department of Health with a relative independence similar to the setup of FDA, which shall be headed by the Director General and 2 deputies. 5 agencies shall initially be subsumed under the CDC, and these are the Epidemiology Bureau, the RITM or Research Institute for Tropical Medicine, STD/AIDS Cooperative Central Laboratory, International Health Surveillance Division of the Bureau of Quarantine, and the Disease Prevention and Control Bureau, except for agencies under it which were enacted or created by laws such as the Mental Health Division, the Cancer Division, and the Oral Health Division. Regional CDC shall also be established. Public health surveillance and research capacities shall be strengthened and updated to international standards to ensure that epidemiology and public health surveillance services are efficient and responsive to decision making. New and state-of-the-art biological laboratory facilities that will serve as the national reference laboratory, unifying all national reference laboratories for infectious diseases, shall also be prioritized. Moreover, the substitute bill before us now provides for some special powers to the CDC in times of public health emergencies and in preparation for such, which are very essential in preventing the spread of diseases and in saving lives. I will not enumerate these provisions anymore as we shall tackle them in detail this morning. So I would like to turn over first the chairmanship to our Vice Chair, Joet Garcia, as I present the draft substitute bill.
Thank you, Madam Chair. Good morning again to everyone. As Madam Chair mentioned, we'll be going through the presentation of Chair Helen with regards to the substitute bill. And we will allow our members and our resource persons to comment section by section so we can thoroughly give our inputs regarding this substitute bill. So first, Chair Helen for the presentation of the substitute bill.
Okay. Ma'am Sylvia.
Mr. Chair, Madam Chair, before we proceed, I just
Yes,
like
DS
to,
Rufus.
I'm attending a 9:30 justice hearing with my two bills. I would just like to manifest that I have read the substitute bill and I am in favor of the approval of the bill after the discussions and the presentation, especially by Chair Helen. Thank you very much and good morning.
Thank you, Deputy Speaker Rufus.
Can we allow Attorney Kat to share the clean copy of the draft substitute bill? Can we ask for a minute of suspension, Mr. Chair?
Committee meeting suspended.
Mr. Chair, can we resume the hearing?
Meeting resumed. Please proceed, Madam Chair.
Yeah. If I may, can we start with section 4, Mr. Chair? And may we encourage our resource person to comment on each section, especially I think the Office of Director Carlos provided us some inputs after the technical working group hearings, which I think very valid, their suggestions and comments. So on Section 4, the creation of Philippine Center for Disease Prevention and Control, I would like to correct my what I've said earlier, that we are creating this following the model of the FDA. As agreed on the technical working group hearing, this center will be created as an attached agency to DOH for policy and program coordination. There.
So first
Am I right?
section,
Section 4. It's in the there. It's
so
in the screen. We agreed on that, right, Mr. Chair? So my suggestion is that we rephrase this language to the Philippine Center for Disease Prevention and Control is hereby created as an attached agency to the Department of Health for policy and program coordination.
all right. Can we hear if there are any comments regarding this amendment from our authors, our colleagues, our resource persons?
Mr.
So if,
Chair.
yes, Yusek Rosette.
Yes, sir. We just like to manifest that we agree and we concur with Chairperson Congresswoman Tan with regard to this policy and program coordination statement.
All right. Thank you, Yusek. Any more comments? So if none, we can proceed to section 5.
Madam Chair,
Sorry.
That's Kong Jun
Madam,
Gato, I think.
Yes, Kong Jun.
sorry, Mr. Chair, on the just a clarification on the definition of terms
So we
in
go to section 3.
section 3, the definition of public health emergency includes natural disaster.
Public health emergency.
Does that include, say, a Luzon-wide earthquake causing a large number of deaths? Does that include a public health emergency?
Mr. Chair, can we hear from Yusek Rosette? Because
Yusek
the
Rosette.
definition of terms, we adopted it from the suggestions of the DOH.
Yes,
Yusek, yes.
yes, Mr. Chair. Thank you. Just like to respond that the natural disaster will be included as part of a public health emergency in terms of the effects that may be brought upon by this natural disaster. That is when the Center for Disease and Prevention and Control will come in.
And Yusek, will that mean it will also depend on the declaration of our national government with regards to that particular disaster? So
Yes,
if, so if
sorry.
if the national government declares there's a public emergency, then that's a time the CDC will come in and it will cover this definition.
Yes, Mr. Chair, because I believe that there would be other agencies more appropriate to be declaring this as part of a national emergency because of the disaster. But in terms of a public health threat, the effects of these natural disasters would be the ones that would be covered by the scope of function of the Center for Disease Prevention and Control.
Okay.
Or is it,
Kong,
is
yeah, Kong Jun.
Mr. Chair, does that mean that in a natural disaster that damages, say, a viral laboratory for or biological laboratory that may cause a leakage or communicable diseases? When I was thinking about, say, a Luzon-wide earthquake causing a great number of deaths, does that fall under the Center for Disease Control or under the, say, Department of National Emergency Disaster Control?
Mr. Chair.
Yusek. Yes, Yusek.
Yes, sir. When in terms of this, as I've said a while ago, when there is a specific disaster, the National Disaster Risk Reduction and Management Council is the appropriate agency to declare and to initially manage this given disaster, for example, an earthquake. But in terms of the effect, if we see that already there are already public health effects or implications to this disaster. For example, if you say, sir, that there is this laboratory wherein a viral or there are contagious diseases already, and then the functions of the Center for Disease Prevention and Control comes in. So true to the spirit of the policy and program coordination function or major objective of the Center for Disease Prevention and Control, we then coordinate with the National Disease Reduction and Management Council as to what should be the response of our country in terms of this disaster.
Kong Jun.
So I was just thinking there might be an overlapping uh, of jurisdiction between the CDC and the Disaster Control, National Disaster and Management Bureau.
Would you
Uh,
want Kong Jun to maybe later on when we go to the functions, we'll be able to identify or you'll be able to identify if there are indeed lapses, conflicts or overlapping with regards to responses to a natural disaster.
I submit, Mr. Chair.
Okay.
Thank you, Mr. Chair.
Thank you, Kong Jun. I believe DBM has some clarification. Is it regarding this particular
Yes,
matter?
yes, sir. Good morning, sir.
Good
This is
morning.
Lynn Adelia from DBM, sir.
Good
We
morning.
would like only to clarify, sir, kasi sabi ho natin, sir, yung natural disaster ho, mapupunta na ho sa ating Philippine Center for Disease po, di ba? Yun ho ang sabi dito.
Mr. Chair,
Yes, Chair Helen.
I think medyo meron tayong misinterpretation on stating the natural disaster here. What we mean here, as explained by Yusek Rosette, is the impact of the natural disaster on health. No, that's when the CDC comes in, no, on declaring the public health emergency. So, kung ang problema po is disaster like effects on the environment, on infrastructure still, yung mitigation and response will be under the DRRMO, no? NDRRMO. So, I don't know lang kung papaano natin ito siguro maging specific on the natural disaster impacts on health.
Ma'am, ang ano ko lang, ma'am, clarification lang, ma'am. Kasi, ma'am, ang DOH right now, they have an allocation for quick response fund. Kasi, ma'am, it's a mix of a natural and man-made disaster. So, in which case ho ba, pagdating sa ganito, are we going to call out the allocation for the natural disaster para ilalagay na ho natin siya sa ating Philippine CDC or ano ho ba yung magiging setup ho?
Mr. Chair,
Yes, you said.
Yes, sir. We need to be clarified that what we are discussing right now is how the public health emergency has been termed and defined. So here in this document, it states that public health emergency refers to that occurrence of an illness or health condition caused by any of the following. So for example, ma'am, or Mr. Chair, uh, if we say that the Center for Disease Prevention and Control would be the lead unit that is recommendatory to the Department of Health and the government for example, right now we say we focus on communicable diseases. That is the only time that the CDPC will get into the picture. As to the other things that we do for the response and even the declaration of a national emergency, it is still within the confines of the mandate of the National Disease Reduction and Management Council.
DBM, Ma'am Jane.
Ang ano lang, clarification lang, ma'am. Yes, ma'am, sir, it's still within the ambit of the of our National Disaster Risk Reduction Management Council. What I'm asking, ma'am, lang, sir, is the allocation for the QRF of DOH, which is a mix of a natural and man-made disaster. Yun ho bang sa natural disaster ho, ay ilalagay na ho ba natin yung QRF allocation lang ho, sir, ng DOH? Kukunin na ho natin yung para sa natural disaster. Ilalagay na ho ba natin siya dun sa ating Philippine CDC? Yun lang po, sir, question. As to the budget allocation. Yun lang po, sir.
Mr. Chair.
Thank you, Ma'am Jane. Yes, you said.
Yes, sir. May I request and manifest that since we did not include our Health Emergency and Management Bureau in the list of units of DOH to be subsumed under the CDPC, that these quick response funds be retained with DOH, because this is that part where we say that the Health Emergency Management Bureau would be the operations arm of DOH in terms of responding to these different public health emergencies, because we say that the CDPC is the policy and program coordination unit of the department.
So it will remain separate, USEC.
Yes po, Mr. Chair.
Okay po yun, Ma'am Jane.
Sir, bali mangyayari, retain pa rin po siya sa DOH.
Yes,
Yes,
yes. Yes, Ma'am
So,
Jane.
ang mangyayari lang ho, sir, when it comes to natural disaster, there will be a transfer from DOH to the center of funds. What I mean is a transfer of funds. Kasi ho, retain pa rin siya sa DOH proper ho natin.
Mr. Chair.
Yes, USEC.
Yes, we do not need to transfer the funds because, as we have said, we are crafting this law and proposing that the operations arm for the Department of Health, in terms of the Center for Disease Prevention and Control, be retained with DOH through our Health Emergency and Management Bureau.
All right.
Okay. Are we clear with
Yeah.
Ma'am Jane?
Yes, yes.
Nakamute kayo, Ma'am Jane. Okay na, no?
Yes, sir. We would like to be clarified kasi, sir, when we do the operation itself, the implementation, there would be a clear, there is a clear mechanism on how do we go about with the QRF.
Yeah. So based naman sa response ni USEC, parang retain pa rin siya with the DOH.
Okay, sir. Thank you, sir.
Thank you. So we're okay with Section 4. We can proceed, Madam Chair, Section 5.
Yeah, on Section 5.
Chair, ma'am.
Yes.
I'm
You
sorry
said?
to interrupt po. Po.
Yes,
May
you said.
we just manifest, ma'am, because the attached agency of DOH, as what Congresswoman Tan has mentioned a while ago, this would be something like when it's attached, it's like PhilHealth, that they would have their independent decision making, and the Secretary of Health is just a member of the board of PhilHealth. Would that be the relationship? Because
Yes.
hindi po ba pwede na it's like the FDA function where the Secretary of Health still oversees the Center for Disease Prevention and Control?
Yes,
Madam Chair.
Chairperson. That's why I corrected it earlier, yung opening remarks ko kasi na model like FDA. So it would be like yung sa PhilHealth na may independence pa rin sila.
So, Madam Chair, if that would so be the case, the Secretary of Health would just be a voting member of this attached agency. Would that be how we are going to do it?
Yes, Yusek Reset. Later on siguro during as we proceed on different section, meron ding observation I think that the RITM can share that we can discuss fully yung setup natin.
Okay, Madam Chair. Thank you po.
Yeah, so we can proceed. Section 5, Madam Chair.
For Section 5, on powers, functions, and duties, we just want to, for purposes of style, we can use powers, functions, and duties. Okay. Can we proceed to section? For policy and standards development, Mr. Chair, if our members have comments on this one, I only have one comment on item number 2. I have a question if we really need to cite RA 11332. What if the same has been amended? Yun yung question ko lang. From the DOH. Kailangan pa ba natin?
Madam Chair, we have included this because this is part of the surveillance function of the Center for Disease Prevention and Control, and this law would provide basis to these functions, Madam Chair.
Again, yung question ko, Yusek, what if ma-amend yung RA 11332?
So, are we saying, Madam Chair, that we just remove it?
Yes. That's my recommendation.
So, Madam Chair, if, for example, we remove it, can we just include the salient provisions of this law into this proposed bill so that we can still have that basis for the functions of surveillance of the CDPC?
Yes, Yusek, we can actually include that also in the IRR.
Opo. Okay po, Madam Chair.
Thank you.
Okay, so we remove that particular phrase in the number 2 provision. Any other comments with regards to policy and standard development? So none. We can proceed to letter B, capacity building and technical assistance. Can we move the screen to show the contents of capacity building and technical assistance? So any inputs? Letter B. So if none, we move to letter C, sectoral and local engagements. So no comments. Then let's proceed to letter D, surveillance.
Mr. Chair, I have a recommendation on letter G and the last paragraph. If we can rephrase letter G on surveillance.
A letter G.
Is it here?
Letter G, Madam Chair.
Okay.
Or
Okay, for a while. Serve as an advisory. And H. Yeah, I think it's here already.
okay. So no change.
Yes, I'm sorry about that. It's here already.
So any more comments with this particular section?
Mr.
Because
Chair,
if
can we ask
yes,
Director Carlos? I think she has comments and recommendation. If she can cite it for the committee consideration. Director Carlos, please. I read your comments and suggestion, which I think very valid po for consideration of this committee.
Director Carlos.
Ma'am, since there have been changes in the order of the provisions, maybe we can look at the latter part. I think we have no comments on this part.
Okay.
Mr. Chair.
Sir,
Yes, you said.
Chair. Wait, ako ang magsasuggest.
Yes, Madam Chair.
Yeah, because on the suggestions provided by our ITM on letter E, provide technical guidance on the procurement of vaccines, drugs, and diagnostics, among others. Meron siyang suggestion on just like what we did in the yung recently enacted law on expediting the procurement, wherein we amended that provision on procurement, the caps on 15% down payment. So she was asking if we can be less stringent on procurement procedures, like yung allowing negotiated procurement or higher caps for procurement of goods and supplies, equipment and services, yung authority to approve advance payment of more than 15%, just like what we did doon sa recently enacted na to allow 50% or more. And the exemption from customs, duties, and taxes for all CDC supplies and equipment procured abroad, since most of the reagents, equipments, supplies, and the likes will not be available locally. Iyon. I think kasi valid. I just don't know where to put that since we are we will soon enact this proposed CDC bill. Baka it will answer na yung future problems natin kasi that law was created only for COVID-19.
Chair Helen, maybe we can look at the vaccine bill that we just passed and try to insert in this bill those specific provisions that will allow us to address future emergencies. Maybe ComSec can check the bill and then suggest later on wording and where to insert it if it will be a separate section.
Yeah. Yes, Mr. Chair.
Mr. Chair,
Yes, Director Celia.
in our comment, we placed the provisions mentioned by Kong Helen under this particular item.
Within
But we're
this
not sure if
provision.
this is the appropriate part into which the additional provisions are to be placed.
Mr. Chair.
Yes, Yusek Rosette.
Yes, Mr. Chair, if we can also manifest that this procurement would only be confined specifically to the functions for surveillance and the laboratory networks of the Philippine Center for Disease Prevention and Control.
Noted, Yusek. Director Carlos, if you want, can you maybe post in our chat if it's easy to do that so that the other our colleagues and our resource persons can see it. So while we're going through the other sections, we can review that before we finalize where to put that particular provision.
Yes, Mr. Chair. Our concern, if we will limit the um, relaxation of the procurement law on things like drugs and not for laboratory and for surveillance only, there might be other commodities which, from our experience in our response in the COVID outbreak, which need to be covered. And we saw that in, for example, the need to procure vaccines right away. We had difficulty, the government had difficulty making arrangements for that because of the cap on the down payment and some other commodities which we had difficulty procuring because of the stringent procurement law provisions. Thank
Mr.
you.
Chair.
Okay. Yes, Yusek.
Mr. Chair, it is the position of the Department of Health that the procurement of the Philippine Center for Disease Prevention and Control be confined to surveillance and laboratory networks. As to the procurement of vaccines, the Department of Health still has that mandate, and we can fully implement or do that mandate, especially when there are these specific laws already provided that exempts us or has given us these safeguards for procurement. So may I just manifest that the DOH positions that the procurement for Philippine CDPC would only be confined to surveillance activities and the laboratory networks.
Well noted, Yusek. Any comments regarding this matter from our colleagues? None? Chair Helen, anong may comment kayo with regards to the position of DOH and RATM?
So we'll ask na lang the COMSEC to take note on the proposal. No? We'll see.
Excuse me. This is Maris from GPPBPSO.
Yes, Maris, may comment kayo?
Yes po, we will just submit our comments for position paper to DBM regarding the section
The one I mentioned on procurement.
yes ma'am.
Yeah. Isn't it included in the recently enacted expediting the procurement of COVID vaccine? We were able to provide less stringent procurement procedures, right, ma'am?
Yes ma'am.
So, but that's specific for COVID only. What I'm trying to say kasi, which I think valid yung ni-raise ni Director Carlos, if it's possible to include a certain provision on that in this bill since we are creating a CDC, or should we go as separate parang amendment of the general procurement law?
No ma'am. We recommend that the HPSB shall also extend advisory and technical assistance to all procuring entities on their concerns regarding the requisites of the bill. So, thus we recommend that this section be revised to read, provide advisory and technical assistance to all procuring entities on procurement matters related to medicines, vaccines, devices, and materials subject to compliance with RA number 9184.
Okay.
Maybe we will just submit our formal position.
Yes, Ma'am Maris. So we'll be guided where to put that.
Yes. In section. I guess it's in B po kanina. We will just look into the substitute bill of the clean draft.
Ma'am Maris, masasend nyo kagad yung suggestion nyo
Yes, sir.
Yeah. Para lang habang we're discussing the others, baka later on we can go back to it.
Yes, sir. Yes. Thank you, sir.
Thank you, Ma'am Maris. Chair Helen, we can proceed to the next section.
Yes, Mr.
It's a
Chair.
direct, I think, yeah. Section 6 on the Director General.
Yes, so from the proposal of the DOH of 15 years of relevant experience, we adopted, as we agreed in the technical working group, 10 years, and this will be headed by Director General and 2 Deputy Director Generals. I don't know if our members have additional inputs on this one, but for me, this section is okay na, Mr. Chair.
Okay. Comments from our colleagues, especially our authors?
Mr. Chair.
Yes, Yusek.
Mr. Chair, I apologize, but can we just go back to the last statement of Section 5 about the advisory body to the Department of Health? Can we propose that we state it as the CDC shall serve as the technical authority for all matters pertaining to disease prevention and control?
That's Section 5
I'm sorry, sir.
of 4.
Section 4, sir. The last
Section
statement.
4. So sa creation.
Section 5G, Mr. Chair, I'm sorry. I'm really sorry.
Okay. 5G. So sa powers functions.
The last statement po after the letter G, there is this statement which states that the CDC shall serve as an advisory body to the Department of Health. If we can restate to say that the CDC will be the technical authority for all matters on disease prevention and control.
Chair Helen, may comment kayo regarding this?
Yusek, so you were saying we'll delete the advisory body kasi parang magkaiba yung technical authority, not necessarily an advisory body. Can we clarify that?
Yes, Madam Chair, being the technical authority for disease prevention and control, the CDPC can also provide recommendations and advisory to the Secretary of Health. It just expands on the functions and gives that emphasis that this unit will be the ones in authority when it comes to disease prevention and control.
Okay, Mr. Chair.
From our members, may comment kayo dito sa suggestion of DOH that CDPC will be technical authority on all matters regarding disease prevention and control, which will be replacing the sentence above it, which is an advisory body to the DOH.
Mr. Chair,
Yes, Kong Jun.
how about removing the technical? How about
Shall be the authority.
giving the authority?
Shall be the authority on all matters.
Regarding disease prevention and control.
Kapag tinanggal yung technical, Yusek, yes.
Parang sole authority na yan, sir.
Including other functions.
Totally independent na sila pag ganon ang tinanggal natin if we remove the word technical, which I think yung CDC is very technical in nature, no? Yung function nila. So, I don't know with Yusek Rosette, but for me, no. Full authority na yung ibibigay natin sa kanila. Super independent na.
Chair?
Yes, Yusek.
Yes, Mr. Chair, I agree with Chairperson Congresswoman Tan. that we should specifically qualify that it is technical authority because the health service delivery part still is with the Department of Health. So we do not give them the full authority, but only the technical authority because this will be comprised of experts and professionals with qualifications to run this unit.
Thank you, Yusek.
I
Kong Jun.
submit, I submit, Mr. Chair.
Okay lang. Okay. Thank you, Kong Jun. So section 6, we can go back to section 6. No comments regarding the section on Director General. So if none, we can proceed to section 7. So these are the DOH units and functions that will be transferred to the CDC.
Pumasok ba yung mga tao ni Paras?
Mr. Chair,
Yes,
I think
Cheryl.
I was advised that the Bureau of Quarantine recommends that the whole BOQ shall be transferred to CDC, not just the International Health Surveillance Division of the Bureau of Quarantine. Can we hear from Yusek Roset if they were able to resolve this matter within the DOH? Do we have
Yusek?
this from BOQ siguro if we can at least hear bakit they wanted the whole division?
Yeah. Siguro inputs from USEC and then if there's someone from BOQ.
Mr. Chair, maybe I agree with Chairperson Congresswoman Tan that BOQ should be heard. But for now, as we have reviewed already their proposal, we would want to manifest that the Department of Health would like to position that it is only the Bureau for International the Unit for International Surveillance that will be subsumed under the Philippine Center for Disease Prevention and Control because there are other units would be for delivery of services. Specifically, they do medical and diagnostics examinations, they do inspections, they do issuance of certificates, and these are purely regulatory functions, which is not under the mandate of the Philippine Center for Disease Prevention and Control.
Do we have representative from BOQ? Wala ba? Comsec, wala? Hi there. Yes, from BOQ.
Bigyan mo nga ng CR sa Kellogg. Huwag mo lalagyan ng gamit.
Can you state your name?
Yes, sir. Good morning, Honorable Congressman and Yusek Berhere. I'm Dr. Olga from the Bureau of Quarantine, the Division Chief for the Quarantine Service. We have our position since December 3 during the internal coordination meeting from the Department of Health. And we have our second position again early 2021 when we had again another set of coordination meeting. Under the Republic Act 9271 of the Bureau of Quarantine, really the primary mandate of the Bureau mandated to prevent the entry and spread of diseases from down to the Philippines and the succeeding domestic ports. And surveillance is more than 50% part of the mandate and also of the regulatory functions of the Bureau. So that's the same and main positions that we wanted to so as to carry out the primary mandate of the Bureau of Quarantine. So without the surveillance division, so there's really a hard time to implement the primary mandate of prevention of entry and spread of diseases because without the surveillance, there's no risk assessment and there cannot be functionality as to the screening of travelers, inspection of vessels and aircrafts, as well as terminals at points of entry. So the regulatory functions is only side by side so as to maintain the primary mandate because if you don't have a sanitary vessels and conveyances as well as sanitary terminals, then you cannot solely prevent or carry out the primary mandate, which is prevention of entry and spread of disease. That's all, the Honorable Congressman and Yusek Barrere.
Thank
Mr.
you.
Chair.
Yusek, can you explain how it will work if we just remove the International Health Surveillance Division?
Yes, Mr. Chair. It's just like what we are doing right now with the Department of Health. The Department of Health retains the regulatory functions because it's really a primary mandate of the Department of Health. Now, in terms of surveillance, the policy guidelines and the different protocols will be issued by the Philippine Center for Disease Prevention and Control, while the implementation of these regulations will be implemented by the Bureau of Quarantine. So rightfully, the international health surveillance can be subsumed under the Philippine Center for Disease Prevention and Control, and the Bureau of Quarantine will retain their regulatory functions through the issuance of these certificates, through the medical and diagnostic examinations that they are currently doing, guarding the ports, providing inputs to the Philippine CDPC. It is not to say that when we subsume the international health surveillance under the Philippine CDC, that the BOQ would lose its link with this surveillance office. We would have a closer link with these offices because we will have implementing arms, and one of them would be the BOQ. Over to you, Mr. Chair.
Thank you, Yusek. BOQ, would you have further comments based on the explanation of Yusek?
Further, sir, the rapid containment phase is also the main concern of the Bureau of Quarantine, which is rapid containment at source. So primarily, there might be a delay on the rapid containment at source if there's no right and updated risk assessment that will be conducted for POE. That's another thing. So if the CDPC can provide a real-time coordination and communication with points of entry, then there's no problem with the rapid containment at source for emerging and re-emerging diseases, particularly coming from foreign countries, which from 2003 till now, all emerging and re-emerging diseases really arises outside of the Philippines. That's all, sir.
Mr. Chair.
Yes, Yusek.
I hope the Bureau of Quarantine recognizes the fact that this Philippine CDC structure that we are proposing aims to strengthen our quarantine regulations in the country, including international health regulations. And when we say that we are subsuming the International Health Surveillance Unit of the BOQ under the Philippine CDC, it doesn't mean that there wouldn't be processes linking these two offices together, and that there wouldn't be rapid containment and surveillance actions whenever there are threats to the country. Of course, we do not want to have that kind of a system. But let me assure the BOQ that we will have that system and processes where we can have that effective linkage so that we can rapidly respond to any of these health threats when it enters the borders of our country.
Mr. Chair.
Yes, Chair Helen.
Yeah, if I may suggest lang that we expound, I think, yung relationships between BOQ, CDC, and Department of Health. I think yun yung medyo nako-confuse yata ang BOQ on working relationship. So they thought that we take out the International Health Surveillance Division from them, and parang wala, all other functions nila ay wala ng connection with CDC. So if we can expound lang siguro, baka po pwedeng sa IRR na. We have to clarify that in the IRR, I think.
I think better we do that in the IRR, but just the same so that we can satisfy yung issues raised by BOQ.
Yes.
Baka Yusek, you may, as early as now, at least give a suggestion on how the relationships will be established.
Yes, Mr. Chair, and we will be working with the Bureau of Quarantine so that they can also provide their inputs as to how this process will be, so that we can immediately draft this part of this bill or the IRR.
Thank you, Yusek. BOQ, okay lang po yun?
Okay, agree po, sir.
Okay, thank you. Anything else sa Section 7?
Sir, go.
Chair, we have a suggestion.
Yes, from the CSC, Ma'am Sheila.
Good morning, Chair. In our possession paper submitted on February 26, we suggested to elaborate this provision, similar to the section in existing laws involving the restructuring of government agencies. So, can I read the suggested provision?
So this is for that will be inserted in this particular section, or it might be a new section.
Sir, it's we suggest to insert certain paragraphs to the section, sir.
Okay, sige. Can you proceed on reading it?
Mr. Chair.
Yes.
Mr. Chair.
Conced?
Yes, Mr. Chair. I would, as a former businessman, Mr. Chair, having drafted a lot of organizational structures, our proposed Center for Development and Control, or Center for Control, is we have to make very clear in our IRR the aspects of research and surveillance and planning, and the aspect of operations, Mr. Chair. Because as you can see, we have a lot of bureaus and offices under research, and there's a surveillance, there's a epidemiology bureau, there's a disease prevention and control bureau, and it's a jumble of bureaus and agencies. We try to consolidate, Mr. Chair. But there is only one entity that stands out, Mr. Chair. That is number 2, the Research for Institute for Tropical Medicine. They are, their basic aim is research. And this is exactly what, as one of the principal authors, this is exactly what I thought was lacking in our response to COVID-19. The research, the planning, the surveillance, and as USEC from the DOH, USEC Rosette was saying, DOH proper would like to control the operational aspect of this disease prevention. So how will that be in our IRR? We have this surveillance, this research, and we are giving half of the control to the mother entity, DOH, or does the CDC also have some operational aspect, Mr. Chair? Thank you, Mr. Chair.
Thank you, Kong Ted. I believe all the offices that were included in this bill were identified, especially their functions, were identified as critical for the operation of our CDC. But siguro we can base from your query, maybe si Yusek Rosette can further elaborate on how this will be implemented. Yusek?
Yes, Mr. Chair and Congressman. These different offices have sort of similar objectives and mandate. Even though the different offices under the DOH, like our Epidemiology Bureau, the International Health Surveillance Unit of BOQ, the DPCB or the Disease Prevention and Control Bureau of DOH, do not have the research in the title of their bureau, but one of the specific mandates of these offices still would be research. And having all of these bureaus or units coming from the DOH together would aim to would make it more we can have a strengthened surveillance and international both international and local surveillance and laboratory networks, and also having this unit which can be able to provide appropriate scientific and evidence-based policies and researches and decisions that will be recommendatory to the Department of Health. So Epidemiology Bureau, sir, is really in charge of surveillance, uh, disease investigation, disease notification. Our ITM is our National Reference Laboratory, and they are the ones conducting researches also for emerging and re-emerging diseases. The STD/AIDS is focused on HIV, and this is a central laboratory which we would want that it be subsumed under our ITM, and therefore here in the Philippine CDC. The international health surveillance of the Bureau of Quarantine would be the ones in charge for our borders, for international health relations, and the possible prevention of emerging threats coming from other countries. And of course, the Disease Prevention and Control Bureau, DOH, would be in charge of the different communicable diseases and non-communicable diseases. So having all of these together, we can have these different divisions that we have proposed. We will have an epidemic intelligence and disease surveillance. We will have a unit for research, training, and reference laboratory. We will also have infectious disease emergency preparedness and response. So this would all be contributing to the objective of this disease prevention and control authority, sir. That it would be the one that government will rely on when it comes to disease prevention and control.
Thank you, Mr. Chair. Thank you for the comments of our very hardworking USEC Rosette. Mr. Chair, given all these intentions of CDC, I would like to ask DOH, Mr. Chair, how did all these bureaus react to the seasonal patterns of, say, dengue? About 15 persons die in Aklan annually. How does the DOH, for example, mitigate and control the rise of HIV during the time of pre-COVID days of Boracay? I mean, do you have parameters or results, metrics that you give out these bureaus so that makita naman namin na may resulta naman ang pera ng kabalambayan? Kasi gagawa tayo ng bureau, wala naman ginagawa. Thank you, Mr. Chair.
Mr. Chair. Thank you, Mr. Chair. Yes, sir. Ang Department of Health po, ito po yung mga bureaus natin. No? So as I've said a while ago, Epidemiology Bureau would be in charge really of disease surveillance, disease investigation, or events investigation and notification. So halimbawa po, tungkol sa dengue, doon po sa DOH, meron po tayong Disease Prevention and Control Bureau as we have here as number 5 under Section 7. May program po tayo for dengue, and that is specifically for preventing the occurrence of dengue. So dito po rin nilalaman yung management natin para sa dengue. Yan po yung programa natin at sinasagawa po natin yan. Meron din po tayong mga commodities na binibili para sa dengue program. Katulad po ng mga insecticides na ginagamit natin to prevent the further spread of this specific disease, yung kanyang vector, yung lamok para matanggal. Meron din po tayong mga pinoprovide na assistance para naman po sa ating mga ospital when it comes to people being admitted for this specific disease like dengue. When it comes to epidemiology, tinitignan po natin through this bureau kung saan nanggagaling ang impeksyon, bakit ito kumakalat, ano ang pwede nating gawin. Dito rin po pumapasok yung ating, iyan po yung surveillance, that's what we call surveillance. So tinitignan po natin yan sa community. And then also pumapasok dito yung notification naman po natin. No? We need to notify so that the reports or the data will inform our decision. So kaya po natin pinagsasama-sama lahat po itong mga opisina na 1 to 5 under Section 7 kasi lahat po ito, mandato po ito ng Department of Health. Pero iba-iba po ang bureau na nag-handle po ng iba-ibang response para po dito sa ginagawa natin for communicable diseases. That's why we would want it in one umbrella para po mas streamlined ang ating proseso at mas maging strong ang ating pag-respond in terms of communicable and eventually non-communicable diseases.
Thank you, Yusek. Yeah, Kong Ted, I think itong bill natin, putting together these related offices, agencies, will further strengthen the need, the various needs of our country, especially in your place. And I think rest assured, yun yung objective natin. That's why we're trying to pass this bill.
Thank you, Mr. Chair. Maraming salamat, Mr. Chair, kay sa DOH, kay Yusek Rosetta. Thank you very much for clarifying these long-standing issues. Thank you, Mr. Chair.
Thank you, Kong Ted. I'd like to go back to Ma'am Sheila of CSC. Actually, she posted yung Section 7 proposal nila, which is the transfer of powers and properties and disposition of personnel. And if I may read it, all powers, functions, assets, capital, records, funds, receivables, equipment, and the facilities of the abolished absorbed agencies shall be transferred to the Center Disease Control and Prevention. The Department of Health shall conduct an audit and inventory of assets, liabilities, and human resources of such agencies. All transferred and new employees shall be subject to the qualification standards provided in the laws, rules, and regulations of the Civil Service Commission. Affected personnel who will not be absorbed in the position of the new staffing pattern of the different policy offices in the Center for Disease and Control Prevention, whether hired on a permanent, temporary, casual, or contractual basis, and with appointments attested by the Civil Service Commission, shall be entitled to applicable retirement or separation benefits under the separation plan. Ma'am Sheila, ang change lang ba dito is yung dinelete na abolished absorbed agencies?
Yes, sir. I think we have to find the appropriate term for that.
Okay. So,
Mr. Chair.
Yes, Chair Helen.
I don't know if it's proper that we insert these paragraphs, or should we create an additional provision to this, no?
If I remember, Chair Helen, parang in the sections below, we have some provision related to this.
Yung transitory provision we have kasi. Yeah.
Yeah.
So, siguro we'll park this suggestion of the CSC and we'll find out later siguro where to put this. But we recognize actually their proposal, no? Instead of abolish and absorb, baka transferred agency. Okay.
Transferred.
Okay.
All right. So we can move to section 8, structure and staffing pattern. So the following centers headed by a Director 4. And then the Director General may create or abolish units, offices, or centers.
Mr. Chair, I think our ITM has a valid question on the creation of the regional CDC. if we may recognize Director Carlos.
Yes, Director Carlos.
Mr. Chair, we just proposed possible functions of the regional CDCs, which we submitted to the Secretariat in the last TWG meeting. And this includes the following, actually almost similar to the functions of the Central CDC, disease prevention, control, and surveillance, provision of laboratory services for detection and identification of infectious disease agents from human environmental samples and food, maintaining an integrated data management system, implementing quality assurance programs for clinical and environmental laboratories through training, consultation, certification, and proficiency testing, policy development, emergency response, public health related research, training and education, maintenance or networking with infectious disease hospitals for referral and management of cases, and establishment of strong communication networks. And we also propose that the regional CDCs be composed of specialists in the fields of infectious disease, public health, epidemiology, and similar fields. Thank you.
Noted, Director Celia.
Mr. Chair, I think yung we have to define yung concern on the regional director will be under the jurisdiction of the CDC or the CHDs. Yung Center for Health Department Development Regional Office. So baka we want to state it specifically that regional CDC will be under the Director General and then the following functions of the regional CDC lang. I think in section 4 or section 5, after ng powers and functions, here, if we can add siguro there. Mr. Chair, if we can ask na lang our secretariat to take note on that proposal and where to place it appropriately.
All right.
Mr. Chair.
Yes, Yusek.
Yes, Mr. Chair, if we may further recommend that the regional CDC shall be headed by a CDC regional director, which actually mirrors what we have for the national structure. And also this CDC regional director will be reporting directly to the Deputy Director General for Surveillance, which is also under the Director General of the Philippine CDC.
Noted, Yusek. Director Carlos, okay po yun.
Sorry.
Director Celia?
Yes po, yes po. Fine with us po.
Okay sa inyo.
Thank you.
So, ComSec kindly take note of such these inputs, and then later on, the committee know where it should be placed in our bill.
Yes, Sir Honor.
Isang section na tayo. Okay. Section 8, any more comments? So if none, we'll move to section 9.
Mr. Chair, on section 9, examination for appointment and promotion, if we may ask if the Secretary of Health, is this the function of the Secretary of Health or the Director General?
Yes, Yusek
Uh,
Reset.
Mr. Chair, we follow the Civil Service Commission guidelines. So if ever it would be a level under, I'm not really sure, pero meron pong part na Director General and then a part na inaakyat na po kay Secretary of Health for recommendation to the Office of the President. Like for example, DDG positions and I think director positions, Secretary of Health na po pag sa FDA, na nire-recommend po sa Office of the President for their approval. But for the lower positions, it's the Director General who's going to be in charge of the approval process for hiring.
Although I think this particular section just talks about the conduct of a system of examination, shall prescribe and conduct a system of examination. So yung actual appointment, I don't think it's mentioned here. Parang I suppose it follows kung ano yung sino yung nag-a-appoint ng different positions will still follow.
Kong Joet, since this section is from your proposal, if tanungin ko
Yes.
lang yung intention, no? Yung examinations that you wanted to conduct is, di ba covered currently by civil service? Then for doctors natin, yung public health and infectious doctors, meron kasing kinakonduct na exams ang different society. Wouldn't it be enough? Hindi ba magiging redundant yung mga examinations? Kasi we have na the civil service, then the different societies for qualifications.
Mr. Chair.
Yes, Yusek, before I respond.
Yes, Mr. Chair, I'd just like to second the inputs of Chairperson Congresswoman Tan that this might be too tedious and it might give limitations on the different personnel that you would want accepted here for the Philippine CDC because of the scientists wouldn't want to be re-evaluated because they have enough competencies and they have undergone a lot of training and examinations already.
Yeah, thank you, Yusek. Chair Helen, bali, our intention is to make sure that we constantly improve and get the best people for our CDC. That's why we suggested this particular provision, wherein I'm not, based on what we are doing now, if there will be a new system that will help further improve yung appointment and promotion natin. I think isa sa gusto natin maiwasan is yung automatic transfer lang. No? I think that was one of our concerns. Yung automatic transfers lang, that might not be appropriate for the particular position in CDC or the function that we need, especially we're creating the CDC to further strengthen our response to various emergencies. So our intent really is to make sure it is of the highest level yung ating system of appointment and promotion. That's why we suggested this particular provision.
So, Kong Joet, actually, maganda yung intention nung proposal mo. But this is what will happen to those employees that currently in the different division na isa-subsume natin. Let's say ang position niya is the head of the division. They need to take examinations designed for CDC functions. Right?
Yes.
Ang
Yes.
intention.
That's
Now,
the intention, Chair.
Yes. So now the question is, who will conduct the examination?
After prescribing
CDC.
Baka we can get maybe comments of the CSC. Ma'am Sheila? Nandito pa ba is CSC still here?
Yes, Chair.
Yeah. Ma'am Sheila, may comment kayo on how to refine this particular section?
Actually, we concur with the comment of Chairperson Tan regarding the examination for appointment and promotion of personnel for CDC. We also concur with what Yusek Berhere said a while ago, that scientists for CDC already have been assessed previously. So another round of examination for appointment for the CDC may be tedious on their part.
Any suggestion, Ma'am Sheila, on how, kasi very specialized nung CDC, on how to further improve our existing system?
Actually, sir, as an input, every agency have their agency merit and selection plan. So I think if we need to have a specialized examination prior to appointment and promotion for CDC officials and employees, they may include it in their agency merit selection plan. And this agency merit selection
Mr. Chair?
submitted to the CSC for approval.
All right, thank you. Is that Kong Jun?
Yes, Mr. Chair.
Yes, Kong Jun.
Clarify ko lang, mayroon examination ang mga papasok dito sa CDC, Mr. Chair?
Based on, if I'm not mistaken, based on the bill, this is more for promotion, but yung existing personnel of the various offices that will be absorbed, I think DOH will have a process of selecting who will be included in the CDC. At the same time, I believe Yusek Rosette mentioned in the TWG that those employees may also have the option either to move or to request to be retained under DOH. Is that correct, Yusek?
Yes, Mr. Chair, that is correct. As with the other reorganizations that we have done before, we have absorbed our employees who were not qualified for the new units that were restructured during our reorganization in the year 2000, I think. Mr. Chair, if I can further recommend, if you may. Yes, sir. First, we'd like to manifest that we are not in favor of subjecting our experts to this examination because, as I've said, they are well learned already. They are experts in their own field, and I don't know who's going to give them the examination because they are the experts already. Second, we have a recommendation which was included in Section 12, letter D, where this is the common practice right now of the University of the Philippines and other institutions, that they have this practice of incentivizing their experts so that they will be retained in their institution by allowing them to still go on their clinical practice. For example, Dr. Edsel Salvania is already a PhD in molecular biology and other of scientific credentials of Dr. Salvania, but he is still being allowed by the University of the Philippines to do his clinical practice. So that is one of the things that can incentivize our experts to stay on and work with us in this Philippine CDC, because as I've said, we might have an issue in recruiting experts if we will be requiring very tedious qualifications and also tedious requirements and not give them the the freedom to do their clinical work also. Also, Mr. Chair, in the Philippine Institute of Development Studies, this is also being done, and they have the best economists here in the country. And they are also allowed to work in their own field, aside from working with the PIDS. So that is a recommendation. It is stated in Section 12, letter D, Mr. Chair.
Mr. Chair,
Yeah,
That is
sorry, Kong Ted. Yes, Kong Jun.
that is what I was driving at, Mr. Chair. Baka pwedeng wala ng examination. Let the Department of Health and CDC just set the standard, the qualification, because it might discourage applicants kung isa-subject pa sila sa examination. So maybe Section 9 maybe
deleted.
rephrase as remove the examination, but gagawin na lang appointment and promotion ang title ng Section 9, Mr. Chair. That is
Noted.
amenable.
Yeah, noted, Kong Jun. Kong Ted, may
Yes,
comment kayo? Same? Is it the same
Mr.
comment?
Chair, I have the same comment. I support the stand of Yusek Rosette. This unnecessarily gives bias to one school because two of the voting personalities would come from just University of the Philippines, Mr. Chair. So I support the stance of Yusek Rosette and Congressman June. Thank you, Mr. Chair.
Thank you for your comments. Chair Helen, if yeah, I'm open naman to removing it, but siguro give me a chance na lang to try and the intent of getting the best of the best for CDC. Siguro we can park this first, and then later on, if I were able to come up with a better provision, then I will submit it to the COMSEC.
I agree, Mr. Chair.
Thank you, Mr. Chair.
Yeah. Si Yusek Rosette, I think has to 5 minutes lang pala. All right. Sige. Yusek Rosette will just be entertaining a call for 5 minutes, but we can proceed to Section 10, continuing competency development program.
Sir, Mr. Chair, ang question lang dito, will the PRC be involved in the continuing competency development program? And I think the RITM has recommendation also.
Okay, sige. Let's hear first from Director Celia.
We have already submitted our proposal po on this particular section on competency development program. We just propose that instead of removal, failure to comply with the continuing competency program being a ground for removal, it be replaced by disqualification of the employee from promotion, which I think has been already amended in this particular provision. And I think that is all from our side.
Thank you, Director Celia. Yeah, would CSC, Ma'am Sheila, would you know if for this particular section we need to involve PRC? Ma'am Sheila?
Sir, Chair,
Yes.
actually we don't have any comment for this section.
Pero yung involvement ng PRC, would you have an idea for such a competency development program?
Oh, for competency development, I think since if you are talking of practice of profession, if the positions in the CDC would involve practice of profession, then there might be a need to coordinate with the PRC, sir.
Kasi, Mr. Chair,
Helen.
currently we have CPD law, di ba? So, and definitely yung professions that we need in within CDC will be under the PRC kasi most of these are doctors, no, or health professionals. So baka lang we need to cite here, no, yung CPD development, no, in coordination with PRC.
Okay. Siguro
We provide permit and units for that.
baka better, Chair Helen, we include that first, yung proviso with regards to PRC, and then we just validate it later.
Okay, sige. We'll take note on that lang, and we'll see how we can improve this provision, Mr. Chair.
Okay. Any more comments on Section 10? Si Director Beverly Ho. Yes?
Good morning. Good morning, Chair.
Yes, good morning.
Sir, probably the spirit of this entire section is about competency building within the CPD. And so if such, the way that the CPD actually works now is that you only get a permit from PRC, but actually they're not the ones who provide the resource persons. So like a local specialty society will go to PRC and say, we will hold this. They give you a permit to hold it so that you can give points to other people. So siguro, sir, yung more important dito is how this links with scholarship programs of the government. If we may be able to get inputs from CSC po, specifically on that. Kasi for scientists, and if they're the best in their field, supposedly being in the CDC, who else will they learn from, di ba? So they actually need to learn from people abroad. And I think the limitations usually is that there's actually no mechanism within government except for aid or sponsorship for you to get those trainings outside. Siguro sir, parang yun dapat yung ma-cover sana ng provision na to.
If you can suggest also, Ma'am Beverly, suggested wording, that would help us also. And then, as mentioned, Ma'am Sheila, yung connection with our the scholarship.
Self-device and continuing competition program.
Sir, we'll just study this section and then I think we can submit a position on this.
Sige. All right. Thank you, Ma'am Sheila. So kung wala na sa section, yes?
May we propose a wording for this?
Yes, please proceed.
Can we add the following? A mechanism to provide training for CDC personnel overseas. For improvement of competency, something to that effect. A mechanism shall be established to provide training to CDC personnel overseas for improvement of competencies.
All right, we'll noted.
Shall be established to provide training for
noted, Director Celia will try to incorporate it in the section.
And one more, Mr. Chair. Sorry, Section 9.
So can we go back? Section 9.
To, appointment and promotion, we propose that the DOH, in consultation with the Civil Service Commission, shall develop qualification standards in terms of education, training, and experience for all technical and non-technical positions. And number 2, a system for promotion and succession planning. I can put it in the chat box.
Yes, Director
Thank you.
Carlo, Mr. Chair.
Thank you. So we can proceed to section 11. No? Section 11 is modernization of public health emergency preparedness. Any comments?
Mr. Chair, I think our ITM has a comment on that.
Director Carlos?
We also propose that acquisition of additional lots, lot property to house the facilities of the proposed CDC be looked into, because currently the different facilities which will be incorporated into the CDC are located in different areas, and to facilitate their coordination and work processes, I think they should be housed in a common facility, especially the central office, which we do not have. I don't think we have such facility in any of the agencies right now.
Mr.
Noted,
Chair,
Director. Yes?
for as an author, I'm amenable on the proposal of Director Carlos. I think very important ito to specifically cite yung proposal niya. You just have to check where to put that.
Any more comments in this particular section? So if none, we can proceed to section 12. Okay, so section 12, strengthened epidemiology, public health surveillance, and research capacities. Any comments, section 12?
Mr. Chair,
Yes, Yusek.
Mr. Chair, if we can request that there be clear emphasis that the local epidemiologic surveillance unit shall be under the supervision and direction of the Center for Disease Control and not with the local governments anymore.
Okay. Noted, Yusek.
Yusek, can you repeat that? What particular letter is that? Letter
This letter B, Madam Chair, it says here, it just stated we renationalize, but the clear statement on saying that it is under the supervision and direction of the CDC is not part of the statement. So if we can just include that so that it be very clear.
Can we also hear the proposal of our ITM, Mr. Chair?
Yes, Director Celia, meron din kayong mga proposal.
Sa konting wording lang po, they be administratively under the supervision of the regional CDC director, the regional epidemiology surveillance units, and the like, and even the subnational laboratories.
As for me, Mr. Chair, again on number 1, the CDC shall, my question is if we are going to cite that specific law on our
Same issue.
Yes, or consistency lang, sir.
Any more comments at 12? So if none, we can proceed. Section 13, Disease Surveillance and Response System.
Mr. Chair,
Yes, Director Celia.
in the last meeting, we discussed that the transfer administratively of the epidemiology and units and the subnational labs to the CDC be done not later than 90 days from IRR promulgation.
So this
We
is
set a timeline, proposed
yes.
timeline.
Okay. So previous you're talking about the previous section, no, Director?
Yes, Mr. Chair.
So
Set
letter
a timeline there during which they will be transferred administratively to the regional CDC director. Not later than 90 days from IRR promulgation.
Director Carlos, what particular section is that and number or letter? Your proposal on the 90 days.
The previous section po, which we just finished discussing.
12?
Yeah.
This po.
I think it's 11. It's in section 11, Mr. Chair.
within 180 days.
Yeah. Okay.
Same ba yun, Director Carlos? Is this the same as what you're suggesting? Within 180 days.
It's different po. I'm referring to section 12. That is the administrative transfer of the regional ESUs and subnational labs. Letter B.
Letter B. So this particular section, letter B.
Yes po.
That it should be completed within 90 days after IRR.
Promulgation of IRR.
Any comment, Chair Helen?
Yes, Mr. Chair. On section 12, letter C, if we may ask lang DBM, if there's no conflict on this letter C, section 12 on Mandana's ruling, can we ask Ma'am Jane? Because the DOE-CDC can only provide capacity building to LGUs that will set up their own LESUs.
Ma'am?
DBM, yes?
Ma'am, may we recognize a representative from the local government bureau to respond on that particular question, ma'am?
Sige po, Ma'am Jane.
A representative from our LGRCB.
Yes. What's his name? Ma'am Jane, nandito siya?
Yes, sir. She's present, I suppose, sir.
Ano pangalan, Ma'am Jane? So we can call her.
We have to coordinate with our DLO, sir.
So wala dito?
I think, sir, she's present because we asked earlier before the meeting who are present from among our
Nandyan.
bureaus.
Oh, parang...
Mr. Chair, balikan na lang
Yes,
natin later.
sige.
But Ma'am Jane, kindly read lang po because of the Mandana's ruling on full devolution. And
Opo.
letter C kasi the LGU shall be provided with LESUs. No? So unless we renationalize, siguro that's the time na yung Mandana's ruling will not be allowed. So paki-check lang po so that we can rephrase this in accordance with Mandana's ruling.
Yes, ma'am, will do, ma'am.
Okay, sige po. We can proceed, Mr. Chair, siguro sa
Apo.
seating provision.
At Chair Helen, may suggestion lang dun sa concern natin earlier pagdating sa either incentive or exemption sa procurement. If it can be in the last paragraph of Section 11, since Section 11 talks about modernization of public health emergency preparedness, in the last paragraph, baka we can insert in the implementation of the modernization program and mandates under this act, the CDC shall, and then that's where we can enumerate what exemptions we plan to include sa procurement.
Okay, Mr. Chair, we'll take note on that proposal.
For Section 13, any comments, Section 13?
Mr. Chair.
Yes, Yusek.
Sir, if we may manifest that the exemption from the provisions of the Data Privacy Act be not part of this, that we still maintain the data privacy law that the implementers will observe due diligence in the handling of personal matters regarding individuals' communicable diseases.
I think Yusek yung intention din with regards to this section kasi I believe in other countries they were able to use yung technology such as whereabouts of those who were positive and inform people within the area na maaring may have been close to that person. They were able to inform them na may nag-positive in that area. So in some countries that was well utilized and it helped them with their surveillance and of course issuing warning to people na maaring ang may mahawa. So how do you suggest do you suggest we don't try to utilize such technology if it means in a way knowing a person's whereabouts, even if it's for it will help us minimize the effect of the pandemic?
Mr. Chair, if I may just recommend that we be just let us be very specific on what we would want to include as part of this bill, but not to exempt in totality the Data Privacy Act because there would be specific conditions where the violations against this law is there has been violations of this law during the time of this response to the pandemic where the rights of the individuals were violated because it was posted in the local government dashboard and all. So if we just specifically state which of the clauses or which of these activities will be included as part of the functions or activities that will be implemented by the Philippine Center for Disease Control so that we do not remove the other clauses and we can still maintain the right of a person to their privacy regarding their personal matters.
Okay. Kasi Yusek pati ba yung kasi the reason why we're doing that is to address yung public health concern. So marami kayo na experience in this pandemic na parang nagiging alibi lang yung public health concern and it's used for some other purpose. Kasi dito naman very specific tayo na the data information will be used for public health to address the public health concern.
Yes, Mr. Chair, we understand that and we understand the intent of the law, but it might be misinterpreted also as having that much freedom of getting personal information in the light of this public health emergency. So for example, sir, the data that we share, these are all anonymized. Only the Department of Health would know the specific name of a person, and we do not share the specific details of this individual. So if we say that we are exempting uh, the implementation of this different response, i-exempt po natin yung Data Privacy Act, baka magkakaroon po tayo ng mga breaches dito po sa mga confidential information ng bawat tao. So may I again just recommend, Mr. Chair, if at all possible, that we do not say in general that we exempt from the Data Privacy Act, but just specify directly whatever clauses or whatever activities that should be undertaken in order for us to effectively respond in a public health emergency.
Same as with the DOH, USEC. I think ang intention din ito is the center shall use whatever technologies available to help out sa public health concern. And then sila lang rin no, yung ine-exempt natin since they need to use such information. No, same as what you mentioned with DOH. So kayo alam nyo, but you do not reveal the individual information to any other agency. So I think yun din yung intent nito. Yes. Yes, Chair Helen.
Yes. Can we ask you, Secretary, what particular information ba yung that will help in preventing yung like yung sa mga outbreak, further increase ng cases? Ang names ba ay kailangan or just location?
Yes, Madam Chair. Pag po may mga outbreaks, unang-una kailangan natin ng location. Kinakailangan lang po natin talaga yung pangalan for us to have this master list and also for us to be able to do further contact tracing. Ang nagiging problema lang po talaga would be the confidentiality, yung mga information pag sinishare na yung mga pangalan, nagkakaroon po ng violation dun sa kanilang individual rights pag na-share na po. So yun lang po yung gusto natin iwasan. Another thing would be, there are specific technologies currently na ginagamit po natin. For example, yan pong sinasabi ni Chair Congressman Garcia about stay safe, for example. So baka mas maganda lang po that we be very specific and state that all of these technologies that will be used should be in accordance with the data privacy law. Because there would be times like ngayon po, ang ating sitwasyon, COVID kaya, ang repository ng information po ng lahat for COVID would be in COVID kaya. Pero ang nag-donate po sa atin kasi ay isang foreigner, no, na firm. So yung data natin nandun lahat sa bansa nila. So kung wala po tayong ganitong batas, baka easily information of our individuals can very well be makukuha nila agad. So ito lang po, mga safeguards lang for us to maintain ito pong integridad ng datos natin. Pero we are agreeing to Congressman Garcia na kailangan po talaga ito because we also found this as a challenge dito po sa sharing of information dito sa response na ginagawa natin for COVID-19. Ang sa amin lang po, if we can just be very specific na lang para hindi naman to say that we are exempting in general the data privacy law.
Okay. Thank you, Yusek. And as Chair Helen mentioned, baka kung if you can submit yung needed information or information that you were able to, that was very effective in doing our contact tracing and others to help in this pandemic. Pakisubmit lang rin kasi baka we can use that as to specify which data are we looking for and which we might need to use for surveillance purposes.
Yes, Mr. Chair. Thank you po.
Yusek, I just want to clarify also kasi with this pala, again ang intent is for CDC to be exempted, but not if there's a partner in providing such a technology, the partner is not exempted. The technology provider, if the database is with them, that partner is not exempted. So dito, I think yung intention is for CDC to be exempted kasi nga kailangan niya for its work in terms of surveillance and response.
Mr. Chair, yes, sir, totally understand that. If we can just be just specific to state that the CDC shall be allowed access to all of this information and shall be exempted from this law, so that wala na pong ibang interpretation that other agencies or units can also be exempted.
All right. Thank you, Yusek. Any more comments? Section 13.
Mr. Chair.
Yes, Yusek.
If we may also include in the statements that that the Center for Disease Control shall include data information, access to data information, and samples collected for purpose of public health surveillance. So, yun lang po dito sa statement kasi para lang po to clarify that it is not just data or information that we are talking about, but we are also talking about samples or specimens that we are collecting and processing as a result of this public health emergency.
Okay, noted, Yusek.
Hindi natin.
So we can proceed. Section 14. Right to information during a sudden onset health outbreak.
So, Mr. Chair, I think Section 14 is very much related doon sa discussion natin in Section 13. Kung necessary.
Yeah. Baka we can just try to refine both sections para one section na lang. Okay, next, Section 15, reporting.
Mr. Chair.
Please proceed, Yusek.
Yes, Mr. Chair, if I may recommend that this Section 15 just be included in the implementing rules and regulations.
Mr. Chair, I agree with the recommendation of Yusek Berheri.
Okay, comments from our colleagues or authors? So agree naman, we just put this in the IRR. Okay, next section, 16. Powers during public health emergencies.
Mr. Chair.
Yes, Yusek.
Mr. Chair, in the light of the manifestation of the Department of Health that the Philippine CDC be the technical authority for policy and program coordination for disease prevention and control, may we strike out this letter A for vaccination and treatment, as these are operational activities, and the Department of Health can very well implement this. We can just give guidelines and appropriate recommendations when it comes to vaccination and treatment, because rightfully, as the technical authority for disease prevention and control, studies, researches, and guidelines to be formulated will be part of the functions of the CDC.
That's 1 and 2, Yusek.
Mr. Chair.
Mr. Chair, yes.
1 and 2. Yes, Chair Helen.
Ako naman po, Mr. Chair, ang recommendation ko is for the whole provision kasi this will form part of the NHSA bill which we passed already in this committee. And then na-mention yung letter number 1, yung vaccine to be administered must not be such as is reasonably likely to lead serious harm. Function kasi to ng HTAC ang etong number 2. So baka po pwede na part siya ng IRR or we keep it doon sa NHSA bill.
Mr. Chair.
Please proceed, Yusek.
Mr. Chair, I second the manifestation of Chairperson Congresswoman Tan. And also, if I may request that the regulatory functions of the Department of Health be retained and delineated from the functions of the Philippine Center for Disease Control.
I agree, Mr. Chair.
Any other comments? So okay tayo to just include this in the IRR, no?
I agree, Mr. Chair.
Thank you, Kong Jun. Okay. So we move to section 17. So section 17, other powers of control.
Same with this provision, Mr. Chair, I suggest that we remove this section. Some of the provisions under this section is within the stockpiling bill.
Okay. Yusek, same din yung comment niya.
Yes, Mr. Chair, I agree with Chairperson Congresswoman Tan, and some of these provisions are rightfully the function of the Department of Health as to the rationing, monitoring of supplies, and the other things that has been stated here. So I second Chairperson Congresswoman Tan, Mr. Chair.
So we include that also in the IRR, unless there are other comments from our members. So if none, next section. Section 18, biological laboratories.
Mr. Chair, ang comment ko lang on section 18, if it is necessary to, they take it out na. There's a word under one roof.
Establish.
I think they take it out na. Sorry, Mr. Chair.
Baka si Director Carlos. May comment kayo sa section 18?
We submitted some comments on this. Specifically the following po. Maybe the other threats should also be included, which I understand was already inserted in the earlier provisions, yung CBRN, chemical, nuclear, and radiologic, which were not previously included in earlier versions. And then also, we already mentioned earlier that the subnational labs should be under administratively to the regional CDCs, which was already carried out. And then some clarifications po on the supervision of laboratories. Currently, they are under the Health Facilities Development Bureau of DOH, but the regulation is under the Health Facilities Services Regulatory Bureau. What we propose is that the CDC only deal with technical recommendations for the creation of standards for biosafety and biosecurity and guidelines for laboratories, and implement QA programs. And we do not think that CDC should be given any regulatory function.
Thank you, Dr. Celia. Chair Helen.
I'm amenable to the suggestion of our ITM Director Celia Carlos.
Mr. Chair.
Okay. Yes, Yusek.
Yes, Mr. Chair, seconding Director Celia Carlos and Chairperson Congresswoman Tan, again manifesting that we delineate the regulatory functions of DOH from the functions of the Philippine Center for Disease Control.
Okay, noted, Yusek Rosette. From our members, may comments? So if none, we proceed. Section 19, authorization to use calamity funds.
Mr. Chair.
Yes, please proceed, Yusek.
May we request that this be removed also, and because I think it is not appropriate to be included here in this bill.
Mr. Chair, I agree with Yusek Rosette recommendation to drop this section.
All right. Any other comment from our members? So wala, we all agree. Okay. Section 20, authority to solicit, receive donations, grants, and the like.
Mr. Chair.
Yes, from the BTR.
Yes, Mr. Chair. Yes, thank you. We'd just like to comment on just a detail. It says here that the CDCP may solicit, negotiate, and receive interest. We suggest that we drop the term interest so that any donations or endowments received by the CDCP will instead we can form a special account in the general fund, meaning it will be available, or it will still be coursed or available for the CDCP for its purposes. But as to our cash management, we will be more flexible so that any funds that the government or its agencies, any funds that we receive, can be made available for other purposes without taking away from the intended objective of the donation.
Yeah. Anong difference nung trust with a special account? Di ba parang if you create a trust account, it's more or less similar to special account?
Yes, Mr. Chair. If we create any trust funds, will be automatically locked in or earmarked for a purpose, and it will not be available for any other use of the national government. If it's a special account in the general fund, let's say if it's not being used, the cash, not the amount, the physical cash can be used, let's say, for other disbursements of the national government. But come the time that the special account funds will be needed, then it will be provided by the Treasury. So we are just more flexible in our use, and we avoid any unnecessary borrowings or financing on our part.
Understood. Yes, Chair Helen.
If we can ask the BTR to submit to the committee secretariat the proposed wordings for this section.
Okay.
Yeah, and number 2, if we should provide exemption from donor's tax.
We will coordinate, Mr. Chair, Madam Congresswoman, with the DOF regarding their opinion on any incentives or tax
so much.
exemptions on that part.
I think si Ma'am Jane from DBM.
Yes, sir. Ano lang, sir, clarification lang kasi, sir. When we say trust, it's more of a government, and one government agency it allows another government agency to implement a program. That is more of a trust. Yun ho yung nature ng trust. Unlike ho, pag sinabi natin solicitation, donation, sabi nga ho ng Bureau of Treasury, it's more of a special account in the general fund, but it has to follow the provisions of the provisions of the specific General Appropriations Act on what should be allowed or what are the procedures in a special account in a general fund. Yun ho ang difference noon. A donation or a grant, ano ho siya, pwede ho siyang pag 1 year, trust pa rin ho siya. Kaya lang nga, it's more than 1 year, talaga hong ano na siya, grant na ho siya. It's an agreement, it's a bilateral agreement or an agreement with a donor on what will they be contributing to a specific program. Yun po, sir, yung difference nun.
Okay. You agree, ma'am, no? na special na tanggalin na yung interest?
Mas maganda, sir, kung magiging special account in the general fund. Kasi ho, namomonitor ho ng treasury and then we will be releasing the corresponding SAROs and NCAs ho to the agency, to our CDC, Philippine CDC.
Okay. Thank you, Ma'am Jane.
Thank you po, sir.
So, any more with regards to this section?
That's all, Mr. Chair.
So if none, Section 21, Joint Congressional Oversight Committee. Section 22, Appropriations. Section 23, IRR, which is 120 days from enactment of the Act. Transitory provisions. So comments on the transitory provisions.
Mr. Chair, if we can place lang transitory provision first before the IRR. So let's make it 23 and then 24 ang IRR.
Number lang.
Yes.
Then, after this section, okay na, no?
I think earlier, meron tayong discussion on the transfer of, I forgot, the transfer of the current employees. Yan, there. This one, the proposal of
from
the
CSC.
Should we transfer it to transitory provision?
CSC?
Yes, Mr. Chair.
Okay sa inyo to part of the transitory provision?
I think dito po sa item F of the transitory provision.
Item F. Pwede dyan, no, Chair Helen?
Yes, Mr. Chair, I think. And then we'll have the Secretariat to review this again.
May mga naiwan pa tayo?
Mr. Chair, before we end, may we ask the DBM, I have a pending question on that Mandana's ruling on the provision about LESU. There. Letter C of section, what section is that? 12. Do we have na, Ma'am Jane?
Yes, ma'am. Si Charm Velasco, ma'am, ang representative from our local government unit.
Charmaine. Yes, from Ms. Charmaine? Yeah, can you comment? Ms. Charmaine, you're recognized.
I think Ms. Charmaine will say having a problem with the microphone. She's in the chat group or chat box. But my question is the implication of this provision on the Mandanas ruling, which cite the full devolution. So, hindi ba technical assistance lang ang pwedeng i-provide, not actually provide the local epidemiological surveillance unit officer?
Yeah, Ma'am Charmaine, paki-type na lang yung response.
Anyway, Mr. Chair, kung wala pa silang sagot at this moment, in the interest of time, may we ask lang that they provide us their comment immediately, no, until tomorrow, so that we can report out this substitute bill.
Ma'am Charmaine, if you can submit by today or tomorrow. Yeah, nag-chat siya. Yes. Sana today or tomorrow, Ma'am Charmaine. Thank you.
Mr.
So
Chair.
meron pa tayo na iwan.
Mr.
Or
Chair,
any other
good afternoon.
comments? Yes, Director Celia.
May we
Sorry.
review po the transitory provisions again? We had some suggestions there.
Sige, transitory.
Letter D po, I think. Lower po.
Letter D.
Regarding the funds, unexpended portion of the budget. Also, we had a proposal that research grants intended for RITM acquired during the transition period shall be solely for the grants intended purpose. Because we're currently now processing some research grants and they might be consummated during the transition period. So we propose that the grants intended for RITM during the transition shall be solely for the grants intended purpose.
Okay. Noted, Director Celia. Bukod sa letter D, meron pa kayo?
Mr. Chair.
Yes, Yusek.
Mr. Chair, just an additional, it's not part of the, I don't know if it should be in the transitory provisions, but may we manifest that the RITM hospital be also strengthened and be more focused towards research and training. Currently, the RITM hospital is still serving patients which are not really in line with the goal for us to improve on research and training. So maybe RITM can be a specialized center for emerging and re-emerging, and that they be given additional funds so that we can have fellowships, we can have trainings, and we can do research in this hospital. So just a manifestation, Mr. Chair, and hopefully this will be part of our bill.
Noted, Yusek. Chair Helen, may comment kayo doon?
Yes, Mr. Chair. siguro Yusek Rosette, if you can provide lang the wordings, no, so we can find out saan specific provision we can include that recommendation. And all other recommendations pa of the DOH to refine this substitute bill.
Yes po, Madam Chair, we will do that and we will work with our ITM on this. Thank you po.
Then from DOH, si Dr. Arnel, I think meron siyang message. Dr. Arnel, would you like to be recognized?
Thank you, Mr. Chair. I just want to be clarified if we can insert the word health between the words public and the public emergency, because per our definition, what we have is public health emergency, not public emergency, under
So,
Section 5A, number 5.
Number 5. Yeah, ComSec Section 5A, number 5. Insert yung health. The word health.
Thank you so much, sir. Thank you so much.
Thank you, Dr. Arnel. Then ComSec, we will also make yung CDC, or we change it to PCDs. PCDPC. O kasi marami. Yeah, we use CDC in the bill.
The recommendation of the DOH, am I right, Yusek Rosette, CDPC?
Yes. Yes po, Madam Chair. It's CDC lang po, Madam Chair. It's Philippine Disease Control, Philippine Center for Disease Prevention and Control. So it's CDPC.
CDPC.
But that is the main title of the...
That's the act.
Mr. Chair, yes.
Tama ba, Yusek? But for the bill, we still use just CDC kasi siya yung parang internationally CDC yung ginagamit.
Yes, Mr. Chair, we agree with that. Although the title would be Philippine Center for Disease Prevention and Control, if we can just use CDC, just to have that alignment.
Okay. You're okay with that, Chair Helen?
Yes, Mr. Chair.
Mr. Chair, we have a question.
Yes, Ma'am Sheila, please proceed.
Na-observe lang po kasi namin that there's no specific section for the powers, function, and duties of the Director General, kasi medyo nakaano siya sa iba-ibang sections of the substitute bill. But if ma-consolidate siya, we would like to suggest to include a specific provision or a specific item stating that the power of the Director General would include the designation and appointment of officers and employees of the center, which of course excludes the Deputy Director General in accordance with the civil service laws and rules. Also exercise disciplinary powers over officers and employees of the center. That's all, Chair.
Thank you, Ma'am Sheila. Chair Helen, okay sa inyo to more or less enumerate yung powers and functions under this section?
Mr. Chair, I don't know what other functions the CSC wanted to specify here. But yung na-mention niya na designation and appointment and disciplinary powers, hindi ba inherent function yon ng isang head of the division or centers? Should we specify pa that powers and functions here?
Ma'am Sheila?
Yes, Mr. Chair. because as we have experienced with other laws that were passed, if those powers are not explicitly provided in the law, the power to appoint rests with the President of the Philippines. So, if the intent of the authors of the bill would give the DG the power to designate and appoint and also exercise disciplinary powers, then we should, I think, there should be an explicit provision in the bill.
So we can ask Mr. Chair siguro the DOH recommendations and CSCs on the powers and functions of the Director General. If that's the case, Mr. Chair.
Okay.
We can submit our suggestion, Mr. Chair. Thank
Yes,
you.
please. Thank you, Ma'am.
Thank you. Thank you, Ma'am Sheila. Anything else?
Mr. Chair, if there's no
Yeah.
other comments from our members and resource persons, may I move for the approval of the draft substitute bill subject to amendment and style. So move, Mr. Chair.
I second the motion.
So it has been moved that the substitute bill be approved subject to amendments and style. Is there any objection? Hearing none, the motion is carried. Congratulations to all our authors and congratulations to all our resource persons and of course all members of this committee.
Thank you,
Thank you
Mr.
very much.
Thank you very much po. Maraming salamat po.
Thank you.
Thank you, Chair Helen.
Thank you, Madam Chair, Mr. Chair. Thank you, everybody.
Please.
Thank you po.
Motion to adjourn, Mr. Chair.
I second.
Second.
Okay, this committee meeting is adjourned. Sana masarap yung pananghalian nating lahat.
Thank you.
Congratulations.
Yes.
Chair Helen,
Congratulations.
congratulations.
Thank you, guys.
Congratulations. Chair Joet,
Thank
congratulations
you.
po.
Thank you,
Thank you.
God
Madam
bless
Chair. Thank
everyone.
you, Mr. Chair.
Bye.
Bye.
Bye.